Thank you so much, and thank you everyone for joining us today for the National Alzheimer's and Dementia Resource Center webinar, Dementia Friendly Clark County, Nevada, What Happens in Vegas Affects the World. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Before we get started, I will turn things over to Erin Long for a brief welcome.
Hi, everybody. I just wanted to thank you for taking time out of your busy schedules to join us today to learn about what they are doing in Clark County, Nevada. We are thrilled to have LeeAnn Mandarino from the Cleveland Clinic Ruvo Center for Brain Health and Danielle Mose from the Clark County Department of Aviation to tell us all the exciting things that they're doing there. I know I'm really excited to see what we're going to learn today, so I hope you enjoy it. Thanks. Back to you, Sari.
Thank you so much. So as you heard, today's presenters are LeeAnn Mandarino and Danielle Mose. LeeAnn Mandarino oversees the Education Outreach and Advocacy Team at Cleveland Clinic Ruvo Center for Brain Health and has worked at the specialty clinic in Las Vegas, Nevada since 2007. She strives to empower individuals and families struck by the physical, emotional, and behavioral toll of neurodegenerative brain diseases by arming them with education and resources that will enable them to care for themselves and the individuals they help. She does this by collaborating with many organizations and agencies in her community, county, state, and beyond. In addition, we have Danielle Mose with us today, who serves as Assistant Safety Officer and the American with Disabilities Act Coordinator, leveraging her extensive experience at Clark County Department of Aviation, where she has worked for 8 years. With 6 years in environmental health and safety, Danielle has developed critical plans like the Title IV Plan and the Airport Sponsor Community Participation Plan for Harry Reid International Airport. She conducts ADA audits to ensure compliance at the Harry Reid International Airport and general aviation airports in the area. Danielle earned both an associate's and bachelor's degree in occupational safety and health from Columbia Southern University. Striving to bring awareness and programs to the airport to accommodate passengers and guests, Danielle aims to be an advocate and voice as an ADA coordinator. At this time, I will turn the presentation over to LeeAnn Mandarino to begin.
Thank you. Good afternoon, everyone, and thank you, Sari and Erin, for inviting us to speak today. My name's LeeAnn Mandarino, and I am a program director at the Cleveland Clinic Ruvo Center for Brain Health in Las Vegas, Nevada. And the theme of my talk today is how dementia-friendly activities can impact the world, specifically if your world has a lot of international visitors. Hence the title, What Happens in Vegas Will Benefit the Rest of the World. Dementia, as you know, is a problem of memory, cognitive deficits, and spatial disorientation, all of which can cause confusion, frustration, anger, depression, and communication challenges. It's true enough when one is in a familiar setting, so imagine the confusion that can occur when an individual living with dementia travels alone or with family and friends. This presentation will highlight some of the programs that the Cleveland Clinic Ruvo Center for Brain Health and our dementia-friendly Clark County partners were able to implement with the backing of an ADI SSS grant through the Nevada Aging and Disability Services Division from 2016 to 2019, and which we continue to implement. Clark County in southern Nevada is the most populous county in the state, with 2.3 million residents and hundreds and thousands of visitors who travel to Las Vegas annually. By virtue of being a popular tourist city and having an international airport, these programs extend beyond our county. Dementia Friendly Clark County, we were formerly Dementia Friendly Southern Nevada. Oh, next slide, sorry, I have to advance. Thank you. Dementia Friendly Clark County is a grassroots organization that started in 2016 in the Las Vegas Valley. So hopefully by the end of this presentation, participants will be able to describe how the strategies and practices developed by Dementia Friendly Clark County should be applied internationally, promoting a more inclusive and supportive environment for people affected by dementia in tourist destinations around the world. Next slide. So we kicked off Dementia Friendly Southern Nevada on World Alzheimer's Day on September 21st, 2016. We had speakers from government, including the 2 federal judges at the bottom right. The mayor of Las Vegas was there, Carolyn Goodman, and our medical director, Dr. Jeff Cummings, was there, as well as legislators. Next slide. This drew the press, and we were able to announce our initiative to the entire community. As we will describe, there's a lot of ignorance about local services for dementia, and so having a media presence is an essential strategy. Next slide. So our first intention in being a member of the Dementia Friendly organization is to be a good community partner. Next slide. Starting off, we didn't have a budget, but we had space and a platform, and were able to convene a group of between 40 and 60 participants monthly. Following the Dementia Friendly America Toolkit, we created a series of community evaluations for different sectors, including healthcare, caregivers, government agencies, businesses, faith-based organizations, and nonprofits. To find the gaps in services, we engaged our community and handed the evaluations out at health fairs, medical education activities, person to person through nonprofits and government agencies, and even provided a way to complete them online. We then analyzed the surveys and set off to fill the gaps. Next slide. As you can see, most people who completed the surveys did not think we had adequate resources, or rather had awareness of existing resources. There were many resources here in Las Vegas, but they had no knowledge of them. So thereby we found our weakness. Next slide. Coincidentally, around that same time, we became a partner on an ADI SSS grant, and our role was to develop marketing materials, training materials, and to support Dementia Friendly Nevada initiative overall. These were some of the things that we were able to complete within the 3-year period. We provided continuing education. Training healthcare practitioners is a very important first step, since many don't get a lot of training about dementia in medical school. Post-conference evaluations confirmed that. Approximately 56% of participants indicated that at least half of the material on dementia presented at these continuing education conferences was new to them. Providing CME credits and continuing education credits is an added incentive to gain participation. Each live conference, and that was the Dementia 2018 and the Dementia 2019 conferences, had between 130 and 200 participants. And it was interprofessional. So we had doctors, nurses, social workers, psychologists. We had a whole slew of different practitioners. And then we also did an online dementia training for the first responder. In this course focused on Alzheimer's disease, frontotemporal dementia, and Lewy body dementia, which is important distinctions for paramedics, police, and emergency room physicians and nurses. Some of the comments I heard from practitioners from these continuing education conferences is that they just don't know where to send someone with dementia after they see them in clinic, which may explain some hesitancy in diagnosing. It's very important that they are aware of the social services that are in the community, because they're often the first contact individuals have with dementia. Next slide. We also turned our attention to community awareness. All of the programs you see here are ongoing. We published a 54-page booklet describing the types of resources one needs as they navigate the dementia journey. We implemented memory screenings throughout the community at health fairs, senior centers, and faith-based organizations. We customized community awareness education for various sectors based on the Train the Trainer model. And we worked with Nevada 211 to have a separate online section for individuals seeking supports for dementia. Before we had our own little dementia button, they were directed to either senior services or mental health supports. And we also trained their call center personnel on dementia. By 2020, we had a body of work that we were implementing. We had trained facilitators for the community awareness training and memory screenings, but then Next slide. COVID hit and it stopped all of our in-person activities. Next slide. So from 2020 to February 2023, Dementia Friendly Nevada met as a state via Zoom and Teams to maintain our momentum. Then in February 2023, we resumed and rebranded under Dementia Friendly Clark County. And here are my colleagues giving the kickoff speeches. Next slide. Our commitment to be a good community partner included a 3-organization facilitator group, which includes the Cleveland Clinic, Alzheimer's Association, and Nevada Senior Services. Next slide. Again, the press was there to give us a boost. Next slide. And here's a picture of our first meeting that was in March. And up front and center, you'll see with the blonde hair on the left is Sherry Swank. She's a longtime media personality, and her mother died from Lewy body dementia. And so she is the one that helps us provide the press to the community. And she's just really an awesome person. Next slide. So we implemented another community assessment to see where the gaps changed, and we provided the assessments in English, Spanish, Tagalog, and Korean. And this is one of our findings. Most of the participants thought that education was lacking for both healthcare and healthcare professionals and the community overall had a lack of awareness about dementia. Next slide. So the second goal of Dementia Friendly Clark County is to be a grassroots organization and to collaborate with our community to make the lives easier for persons living with dementia. The hospitality industry is a major employer in Las Vegas, which is what brings me to the thesis of this presentation. That is, what happens in Las Vegas does not necessarily stay here. And this is true for all tourist organizations or all tourist destinations. Next slide. To be a dementia-friendly tourist destination, we must provide accessible facilities and clear signage and educate as many people as possible who interact with guests that they will encounter individuals living with dementia, and then show them how to interact with and communicate with these individuals. We also must ensure that our emergency responders are educated and that our facilities are safe. Next slide. Dementia-friendly training in a tourist town is a win-win for both families traveling to the Las Vegas Valley and for tourism. Some of the benefits for dementia-friendly training for the tourist town include an enhanced reputation. Being recognized as a dementia-friendly destination will attract a broader range of tourists, including those with dementia and their families. And it also has economic benefits. Increased visitor numbers and longer stays will boost the local economy through tourism and related services. A supportive environment for residents with dementia will create community well-being by strengthening community bonds through inclusive practices. At the same time, we are caring for our guests. We'll set a standard by serving as a model for other tourist destinations worldwide and encouraging the global adoption of dementia-friendly practices. We'll raise global awareness, highlighting the importance of addressing dementia in all sectors, including tourism, and promoting international collaboration on dementia, research, and support. And most importantly, this improves quality of life for a lot of people by enhancing their lives and the lives of individuals living with dementia and their caregivers globally, and helping to reduce the stigma and increase understanding of dementia worldwide. Next slide. So starting with Reed International Airport, we provide at least 2 trainings per year. Our last training was on June 18th, where they recorded us so they could put up the course on their training website and employees for all shifts could watch. Next slide. So this is the crew that goes out and helps train dementia at the airport. And you see, this is our second course of the day. And this course was full of Las Vegas Metropolitan Police Department employees as well as facility engineers. Next slide. Okay, so what many airport employees do not realize is the sizable number of individuals with dementia who visit Reed Airport annually. So we're going to put up a poll and ask the audience, how many passengers living with dementia do you think visit Reed Airport annually? Is it 50,000? 250,000? 500,000? 800,000? Are we getting any results?
Yep, we have about 67% of people have participated. So we'll give it
Okay.
another second here. Let's try and get to 75%.
All right, I see
All right.
that most people say 250,000. He just wiggled the answer for me. It's 800,000. So let's do some math here. In an April 2024 article in the Review Journal, they reported that Reed Airport is slated to surpass 57.6 million visitors in 2023 by 1.7%. In the United States, the prevalence rate of dementia among adults aged 65 and older is between 10 and 15%. We'll assume a conservative estimate of 10%. Considering that airport visitors are likely to include a mix of age groups, we won't assume that all visitors are within the elderly demographic. If around 15% of the visitors are age 65 and older, that would mean approximately 8.64 million visitors fall in that age group, and that's 15% of 57.6 million. Applying the dementia prevalence rate of 10% to this group, we estimate around 864,000 visitors aged 65 and older will have dementia. And that's a big number. So, what is a person to do who is living with dementia when they are confronted with a scene like this? With all the multiple steps it takes to get through security, who should go through the scanner first? Depending on cognitive ability, the care partner would likely need to help the person living with dementia with the belts, possessions, and all the rest, so it's probably better they stay behind to help, right? But what if their loved one wanders away once they get through the screening and you're still waiting in line to get scanned? So TSA has something called TSA Cares, which Danielle will talk about. It's on all airport websites, and it helps people during screening if you call ahead, but many people don't know about this service. And if they do, we found that there are not uniform services among different airports. This is something we talk about at these trainings. Next slide. We also talk about physical space and how flooring can affect someone with dementia. Different color flooring, which is common in airports to indicate walkways, can cast shadows and misperceptions to the person living with dementia and lead them to think there's a hole on the floor or water or what have you. Another thing are restrooms. Multiple entrances and exits in a restroom gets the best of us turned around. I know I've gone through one entrance, came out the other side of it, and I just lost my way for a minute. And also signage. Signage should be large enough with enough contrast to help individuals with bad eyesight navigate through an airport. Next slide. And so let's talk about restrooms. I have a little anecdote here. At our first airport training, one of our co-facilitators was a caregiver for his wife who was well into her dementia diagnosis. He relays how taking his wife to the restroom was the bane of his caregiver existence. Back in 2017 or 18, I can't remember what year that was, there were not a lot of family restrooms in the airport. So if he was waiting at a gate, he would have to pick up all of their belongings and travel a half a mile or so to the family restroom, all the way at the end of the hallway. The CEO of the airport happened to be in the audience that day. A year later, I was in the airport and I noticed numerous new companion care restrooms. And I always wonder if Randy's presentation that day was a call to action. So dementia education does help. I think. I believe. Next slide. We also describe what dementia is, what the possible signs of dementia are, and examples of what dementia may look like in their role at work at the airport. For instance, if you're a vendor and somebody forgets to pay for an item at the store, it may be because of memory. And I know there's a lot of angry people and upset people at an airport, but sometimes if they're an older individual and they seem confused, it may be because of dementia. Next slide. So thus, we really try to clarify customer service techniques and how to better communicate with someone who may have dementia. And here are just 10 pretty simple steps that some people may not consider to approach the person from the front, to identify yourself, maintain eye contact, to address the person by name if you know it, present one idea at a time so it'll help them understand more clearly. Repeat or rephrase the person's responses to you so that you're clear on what they're saying and they're clear. Ask simple yes or no questions. Use gestures because that helps emphasize what you're trying to say. And listen actively. And finally, let the person know if you're going to touch them so you don't startle them. Next slide. So after our June 18th training at the airport, we put out an evaluation, and here are some of the comments that were made. I like the 6th one down. It says, I once assisted a passenger with dementia who kept telling me the same joke over and over. I laughed every time. I love how expressive this lesson was with patience and understanding. I'd learned things I could implement into my own training. It was very helpful. And then a lot of people really emphasized the need for TSA to be available at these trainings, and some even thought that this was a mandatory course. So I would now, next slide, like to introduce you to Danielle Mose, who is an ADA coordinator at Reed. There you go,
Thanks,
Danielle.
LeeAnn. My name is Danielle Mose. I'm the ADA coordinator as well as Title VI coordinator as well at Harry Reid International Airport, as well as the other general aviation airports that we have here in Las Vegas, Nevada. So today I'll be discussing more so of what we have here at Harry Reid. So just as LeeAnn was saying, she came out and gave us a dementia awareness education seminar here at our airport. And it was not only just for DOA employees, but as well as tenants. So we open all of our training sessions and awareness to all of our employees as well as tenants, so they're aware of what services we can provide here at the airport for our guests and passengers that are traveling with dementia, as well as other hidden disabilities here at the airport. So moving forward, we will be having more awareness training to all of our employees here at the airport. Next thing we're going to be talking about is the wayfinding signs. We are going to be doing more upgrades here at the airport, which we have previously, as far as the signage, making sure that the wayfinding sign is legible for all of our guests and passengers that are traveling throughout our facility, as well as I just recently implemented departure zones at Terminal 1 and Terminal 3. We do have the handicap drop-off area, so it'll be convenient for your loved ones or even just guests and passengers that need that special assistance and accommodations, where they don't have to just travel through the parking garage or getting from your Uber and Lyft. So we have that accessible for our guests at our curbs at both Terminal 1 and Terminal 3 departures. Next slide, we're going to be talking about TSA Cares. So this is not really mentioned. A lot of people don't know, they're not familiar with this service at TSA Care because they don't really advertise it. And a lot of times people don't know unless, you ask or someone knows. So this service here is provided from, with TSA. They, basically is for, passengers that have visible disability as well as medical conditions. So this service is, provided to all of our guests and passengers, as well as, caregivers that are traveling through the TSA security. I know when you're traveling through, this area, it becomes very frustrating. You get, a lot of people get confused. So with this here, it's like basically a screening process that's convenient for our guests and passengers, as well as caregivers, where they won't get separated in the lines. This service can be requested 72 hours prior to their departure, as well as calling the 800 number as well. A lot of times when you're traveling, a lot of people don't, prepare prior. So this service can be, available at the last minute. All you need to do is just go ahead and request that assistance at that time, and they'll be able to put you through a different line as far as the screening process. Additional to TSA Cares, going back to what LeeAnn was saying about the companion restrooms, as of by 2030, all large hub area, large airports are required to install adult changing tables in our companion restrooms. And this is, this is for all over. So everywhere you go, as far as in the United States, it is required by law, by TSA, not TSA, sorry, by the FAA, that it is required to have adult changing tables in our airports. And that will be both secured side and non-secured side. So you don't have to just, look for a bathroom that has this. It will be in all of our companion restrooms in both locations, at Terminal 1 and Terminal 3. Is there anything else? And I think that's it, LeeAnn.
Thank you, Danielle. Very good.
Thank you.
Appreciate the information. How do we get that word out about TSA Cares? Right. Next slide. So not only do we provide airport training about dementia to airports, but we also have community education programs to hotels, to hotel employees, and future hotel employees at the UNLV College of Hospitality. Again, the number of people who visit Las Vegas with dementia is substantial. In a January 2024 article in the Nevada Independent, there were 42.5 million visitors in Las Vegas in 2023. Using the same formula, let's do some math. We take the 15% Las Vegas visitor rate of 42.5 million, that comes to 6.38 million over the age of 65, and apply the dementia prevalence rate of 10% to this group, and we estimate there are approximately 637,500 visitors staying in Las Vegas hotels who could possibly have dementia. The next slide. We also have customized dementia awareness programs for the Las Vegas Metropolitan Police Department. At public venues, this here is the picture of the Smith Center for the Performing Arts, and at parks and recreation, because we have several state parks, which are a tourist destination for hiking, and signage is very important, so people don't get lost in our blazing heat out here in Las Vegas. Next slide. So, did you know that Las Vegas is among a small group of cities with the most churches per capita in the United States? It's true, according to NBC. Thus, we've created a faith-based community awareness program and have found great success as parishes have created support groups and respite services for their parishioners and upgraded spaces for families affected by dementia. Next slide. So, some of the goals for dementia-friendly faith communities include educating congregants about dementia, including people who are living with dementia in church presentations and asking them to share their stories, assessing congregation facilities for accessibility and safety, talking about the behavioral manifestations of dementia, offering a volunteer to sit with someone with more advanced dementia, providing a quiet area for the person living with dementia and their caregivers, and clear signage, of course. Next slide. Again, spaces are very important for individuals who are living with dementia. And so here are some of the recommendations to make sure buildings are well lit, to make it comfortable and have enough space to walk, to use information notice boards, to use clear signage, and again, that all-important unisex facility. Next slide. Oh, I do want to say that one of our churches that we presented to is New Song Lutheran Church here in Las Vegas. And they completed, after we presented to them a few times, they completed an ambitious reconfiguration of their parish as a result of our trainings. So don't forget your rural communities. In Nevada, there is tourism in our rural communities as well. And there's Pahrump and Mesquite. And it's particularly important in rural areas because Alzheimer's disease is more common in rural communities, and there's higher rates of burden and death from Alzheimer's disease. So it's very important for these communities to have this type of training. In Nevada, we only have 40 geriatricians in the whole state, and 71% of rural primary care physicians throughout the United States say there are not enough specialists. So just imagine our problems in Nevada. Okay, next slide. So to wrap up, tourist towns have a special responsibility when it comes to educating workers and residents about dementia. And we should be aware of the challenges these destinations encounter, like securing funding for training programs and services and sustaining these programs. We must also be culturally sensitive due to the diverse populations that come here, and on overcoming the stigma that some cultures may have for individuals that are living with dementia. Then we really must be innovative. Technology can bring us together to make the world a little less distant and be a big help to enhance dementia training and services throughout the world. So let's share experiences with the world and build upon our collective knowledge. Next slide. So in conclusion, and I'll just read this, dementia training and services in tourist towns are crucial for creating inclusive and supportive environments. By prioritizing these initiatives, tourist destinations can provide much needed respite for families affected by dementia and contribute to global dementia awareness and support. As we move forward, it's essential to continue innovating and collaborating to address the growing challenges of dementia worldwide. Next slide. And that concludes our presentations.
Thank you so much, LeeAnn and Danielle. Appreciate your presentations. Lots of great information there. We're going to go to the question and answer session. You can enter your questions into the Q&A pod, which you can see at the bottom of your screen. And as those questions are getting entered, we can go to that next slide, Cameron, and then pop back to the contacts in a minute. Just to take a look at this, we want to thank you all for being here. If you want to be alerted when the next round of Alzheimer's Disease Programs Initiative funding is announced, you can sign up at grants.gov for notifications. The search term is Alzheimer's Disease Programs Initiative. This program is the one that came after the ADI SSS program that LeeAnn talked about. And if you need to contact us, you can contact us at NADRC-webinars@rti.org. So let's go back to that contact slide in case people want to jot down anyone's information, and we'll move to some questions here. So one of the questions that came in is, to your knowledge, LeeAnn, do you know any other airports that do dementia-friendly training?
Yeah, several are doing it now. I think we were one of the first back in 2017, but I know like Minnesota has a really advanced airport, which actually already has changing tables in them. And because, you know, if somebody soils themselves, it's really important to provide that privacy. They actually, I think, have a lift that helps lift people if they have a disability as well. I know Arizona has the little flowers that you could give somebody who has dementia if they come to the airport. And if they have that flower around their neck, then I think they could just go through TSA much more quickly than the rest of us.
Nice, great. Do you know, someone said in Phoenix Sky Harbor Airport has it as well. I don't know if you mentioned that one.
Yeah, that's the flower one.
Oh, nice.
LeeAnn, could I include some
Yes.
information on that? So for the Phoenix Airport, it's called Cacti. They have a lanyard, and so it's not the sunflower lanyard, but it's called the Cacti. So they have like an internal. So yes, but they do have that service that they provide for hidden disabilities.
Thank you so much.
You're welcome.
So do you know if any of the training for the airports is publicly available? Is yours publicly available, LeeAnn, or are any others?
Oh, I could share it. I have no problem sharing it. If you could just contact me.
Great. So anyone who is interested, that's LeeAnn's email right there on the screen. Can you tell us a little bit about what you have found to be most engaging or impactful parts of the training program? LeeAnn, from your perspective as the presenter, and then maybe Danielle from your perspective as someone who's observed the training.
That's a good question. Let's see. They're very interested in the disease states and the different types of dementia, and they're interested in the TSA portion of people going through that mess when you get to the airport. What else? The caregiver part is very important. What the caregiver is going through, if they're with a person in that scenario that they're tending to and trying to take care of while doing all the numerous other things that they have to do when they're going through an airport. And then again, like when we did faith-based, physical space is really important to a lot of people. And then having services, you know, always knowing what the resources are. So a few of the parishes that we've worked with started a dealing with dementia program. They started respite programs for fellow congregants that needed to go shopping or something. So they're interested in resources as well. Again, a lot of people just simply don't know that these resources exist.
Sure. Danielle, do you want to mention from your perspective what was the most impactful part?
Yes, so as far as my perspective, as far as receiving that training as an employee here at the airport, I think it's more so the awareness, the signs to look for. A lot of, tenants and employees here, you can't really determine who has dementia or who has a hidden disability overall. So just knowing the signs and, what services can we provide, or what can we do to help that person or that family member that is traveling to make it more convenient and easy travel and not be stressed. That's our goal, is to make sure that what can we do to, provide that, that easy, less stress travel through the airport. Because, just overall, when you're traveling through the airport, it's chaotic, you get stressed, you get overwhelmed, there's so much stuff going on. So, just receiving that training from, LeeAnn, it just gave us more of like an eye opener, and just gave us like a, overview of this is what they had, this is the different dementias, this is the signs, what can you do to help eliminate the stress that, both the person that is receiving, that does have, dementia, and the caregiver, what can we do to help? So I think just overall, with us being at a busy airport and it's international, it's just basically receiving that information and that education is very helpful for our airport.
Great, thank you.
You're welcome.
Danielle, another question came in asking about TSA Cares and wondering if TSA Cares exists at all airports, and is it the same phone number that was on your slide for all, or are there
Yes.
phone numbers specific to airports?
Yes, so TSA Care, that is, as far as throughout the United States, that is available, at every airport. All you have to do, and that is the same phone number, the same email, address as far as submitting the form, or you could call them, 72 hours prior, but they do have that at every airport. I know, I received a, request or a person that was coming from overseas. They asked if customs have that type of service as well. And that's something that I can't answer because, you know, TSA and customs, they're two different things. So, but they do provide that assistance as well, but it's different process. And they just have to notify the person when they travel. But overall, TSA Cares, it's throughout the United States.
Great, thank you.
You're welcome.
LeeAnn, can you talk a little bit about how you're going to be able to sustain your programs?
Well, we have volunteers that work with us. And then fortunately, we work in organizations that are very generous with their employees' times. So, I mean, they have a vested interest in, for instance, the Cleveland Clinic and the Alzheimer's Association, Nevada Senior Services. They have a vested interest in providing resources to these individuals. And so they work very diligently on dementia-friendly projects. And so if you have a good project, you could attract the volunteers that want to participate. And so we rely very heavily on volunteers.
Great, thank you. Cameron, can you go back to slide 30 for a minute? It has the TSA Cares phone number. And then let's see. Can you talk a little bit about, sorry, I lost the question. Oh, can you talk a little bit about the community survey questions? You talked about the community survey, LeeAnn, at the beginning, but do you have examples of some of those questions?
I could pull them up. It would take me a minute to search it out. But the first go around, we broke up into different sectors. So there was a healthcare sector, there was a caregiver sector, a faith-based sector, and we really honed in on questions that would help us figure out where the challenges were when it came to dementia services. And so we try to, you know, try to make it as short, as sweet as possible, because you don't want to turn people off to having to fill out a long survey form, but we try to make them as pointed as possible. So I would really have to look them up. I don't have it ready. But again, we put a lot of thought into our community surveys.
Great. And then do you have an idea of how many airport employees you've trained overall at Harry Reid?
Say that again, you kind of broke up.
Oh, so sorry. Do you know about how many employees you've trained total at the airport?
Hundreds over the years, hundreds.
Yeah, great.
And because we've been recorded, maybe more, because, you know, not all people, you know, people work different shifts. It's a 24/7 town. And so they recorded it and it's on their training website, right, Danielle?
Yes, that's correct. So all of our trainings are available, accessible to all of our employees that are not able to attend. So we do have that, you know, that recorded prior or after, so they'll have access to that. So everyone is actually notified.
Great, thank you.
You're welcome.
Now that we've had that number up for a little bit, we have a request to show slide 34, Cameron, that the behaviors that might happen at a church, or I believe this is the one that they wanted. If not, please write in again. And then another question came in about, do you have any idea why there may be more prevalence of Alzheimer's disease in rural areas?
You know, we were a part of an ADRC, Alzheimer's disease research center grant, and that was our focus on why people in rural areas have a higher prevalence for dementia, Alzheimer's disease, and why it's more burdensome for them. And one thing could be the comorbidities of people who live in rural areas, maybe higher smoking, maybe less education, you know, different lifestyle factors, because lifestyle plays a really big role in developing dementia. So that could be, I mean, none of this has been published yet, so I can't say for certain, but these were some of the considerations. Plus, they have less resources. They're probably diagnosed later because they have less access to practitioners and healthcare. So these are a few reasons why we think there's a higher prevalence of Alzheimer's disease and dementias in rural counties, rural areas.
Great, thank you. All right. Some other questions. Do you have an idea of the budget that it took to put together the training, LeeAnn?
Again, it was, you know, we were on the ADISSS grant during this time. And it's just part of our role. You know, we took this on at the Cleveland Clinic. And I think, you know, this was a particular project for Cleveland Clinic, the Ruvo Center, but there were a bunch of other things going on with that grant at the same time. But this was one of our projects. So it was just the salary of the persons that were writing this up and training the volunteers. That's it. And then all you have to do is really put it out there, word of mouth, you know, let people know that, you know, you're providing this type of training, and it sort of just takes off. It's not a big budget though. If you have somebody who's working for you that you could provide time to create these types of programs, that's really the only budget, maybe some travel.
Great, thank you. Do you need proof of a person's disability, Danielle, to get assistance from TSA Cares?
Absolutely not. They are not by law, just as far as the ADA coordinator, no one cannot question no one's disability regardless. But however, if they're traveling with a medical device, that's something different. Because of course, when you're traveling with medical device, they want to make sure it's not explosive or anything like that. But as far as any type of like disability, they're not supposed to question that. Now, say for instance, if they're like something where they're traveling with, you know, like say doctors, you know, orders or something like that, like, you know, usually they'll wear like I know here we have some passengers, they travel with like a lanyard that has their information on there. So like say if someone has seizures or, you know, they have some type of other disability that they want people to be aware of, especially if they're traveling by themselves, it gives that person, as far as like the agent, as well as the employee, notification that, hey, something's, you know, going on. Or, you know, if something occurs, this is how you treat it. But as far as like questioning anyone's disability, absolutely not.
Great, thank you.
Yeah.
This might be hard to do, Danielle, but can you mention like what does an adult, someone's asking for what is an adult changing table?
So adult changing table is basically, it's just kind of think of like a regular changing table for a baby, right? I mean, it's kind of hard, but it's larger, it's convenient, and it holds about over 260 pounds. So like I was mentioning earlier before, they actually had someone that worked at the airport, and they traveled outside the country with their mother. And so when they went to another country, they're like, they had to change their mom. But unfortunately, that airport did not have an adult changing table. So they actually had to change their mother on a bathroom floor, which is disgusting. So they took that experience and brought it, back here, and they implemented that change because they're like, just to be able to change someone on a floor, that's degrading. So this assistance here will actually help that person, their caretaker, change that person on the changing table instead of being on the floor. So it's more accessible, convenient, especially when you're traveling. So with the adult changing table, they do have some that's more automated, where if you press a button, it will lower it where they're able to get on there as far as accessible. They also have, like LeeAnn had mentioned before, there's Lyft, which is not based on the ANSI standard, it's not required, but you can go ahead and include that into that changing table where it'll be more accessible and more convenient, and for that person as well, lifting that person on there, or if that person's traveling, by himself or whatever. So, but as far as like the changing table, it's affixed to the wall, and it just comes down, and they're maintained and maintenance every day by a custodian or a maintenance worker, just to make sure that it's functioning.
Wonderful. Thank you so much.
You're welcome.
So we have time for a few more questions. Let's see. The changes, someone's asking about who's going to enforce the installation of the changing tables. I think you said it's an FAA regulation, correct, Danielle?
Correct, that is. So by 2030, it is required, because it is a standard, that all of the large airports are required to have the changing tables installed in the restrooms. Mainly in the companion restrooms, that's where you'll normally find it, but at least it needs to be one in each terminal. But here at Harry Reid, our goal is to include it and install it on our secure side and non-secure side. So if you're on the non-secure side, if you're just at ticketing or whatever, you'll have that. Or if you're going to baggage claim, it'll be available. As well as if you're at your gate and you need to go to the restroom, we'll have those on the secure side as well.
Great, thank you.
You're welcome.
LeeAnn, did you talk a little bit about how you weave respite into your programs? And if so, can you give a little more information about that?
Well, we do have some respite at the Cleveland Clinic, and I think Alzheimer's disease or Alzheimer's Association and Nevada Senior Services also have respite, and there's our two partners on the Dementia Friendly Clark County. But some of the things that we do at our center is we have art programs, and it's not a true respite anymore where the caregiver can go do something and leave the person with dementia with us. But it's sort of a team approach to respite, like art programs and the learning arts and various programs like that. Dementia Friendly Clark County per se does not have respite programs, but we do try to educate people about respite programs and let the community know what respite programs there are for them.
Great, thank you so much. Well, it looks like we've gotten to all of the questions that we can answer today. So I want to thank you both for your excellent presentations and the information you shared. And thank you to everyone who joined us today. And please keep a lookout in your email if you haven't seen it already, because we'll join together again on August 27th for a webinar on cognitive stimulation therapies directly supporting people living with dementia. An email will go out about that tomorrow. And then as a reminder, if you need to reach us at the webinar team, you can contact us at NADRC-webinars@rti.org, which you can see right there on your screen. So this time I want to thank you again, LeeAnn and Danielle. This was fabulous. And we're getting lots of comments thank you for this wonderful information from our participants. So thank you everyone and have a wonderful afternoon.
Thank you all.
Thank you.